Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Salsabila Sekarlembayung and today I will present 3 journals about vitamin D. The first journal is titled Immune Function of Vitamin D in Type 1 Diabetes Mellitus. Background of this journal is it has been proved that vitamin D is related to a variety of autoimmune diseases. Type 1 diabetes mellitus, being generally accepted as autoimmune mediated, is also proposed to be associated with the vitamin D status of human body. The aim of this journal is to review briefly the epidemiological correlation between the vitamin D status and prevalence of TIDM, the possible mechanism underlying this correlation, and clinical trials focusing on the therapeutic prospects of vitamin D in the treatment of TIDM. The results as several cross-sectional studies have reported association between low vitamin D status and prevalence of TIDM. Different results have been reported from varied ethnic backgrounds. A research by Panierekis et al. Reported the association of all these 4 single nucleotide polymorphisms with TIDM prevalence in the Greek population, while others reported that just one or several of the polymorphisms might indicate susceptibility to TIDM. The conclusion in this journal is between vitamin D and TIDM, but this association is not conclusive, with conflicting data existing. Therapeutic trials are aiming to prove the interventional benefits of vitamin D on TIDM. In the future, multi-center, double-blinded RCTs are required to make the final answers. The second journal is titled The Potential Role of Vitamin D for Prevention and Treatment of Tuberculosis and Infectious Disease. The background of this journal is vitamin D deficiency is a common condition among several populations in the world. VDD is associated with higher incidence of immune system disorders and faster progression of some infectious diseases. Vitamin D is known to be of psychological importance. It is considered an essential micronutrient for the bone health and plays a beneficial role in the prevention and or treatment of a number of chronic diseases. The aim of this journal is to prove the potential role of vitamin D to prevent and treat tuberculosis and other infectious diseases. The result of this journal is a cross-sectional study was conducted among pulmonary tuberculosis patients. According to Spectre, VDD is present in 25% to 75% of infected persons and have been associated with more rapid disease progression. In the meantime, infants born to HIV-infected women with vitamin D deficiency are at increased risk of infection and have decreased survival. A key point for an effective supplementation should be the use of oral monodose packed with commonly used nitrogen technology to avoid any risk of oxidative stress. The cheap cost of vitamin D, around 60 USD per kilograms, makes it an affordable technology for developing countries. The conclusion is the connection among vitamin D, infectious and immune function in the pediatric population indicates a possible role for vitamin D supplementation. The third journal is titled Effect of Vitamin D Supplementation on Recurrence of Acute Otitis Media in Preschool Children. This journal is acute otitis media is defined as an acute inflammation of the mucosal membrane of the middle ear cleft, most commonly occurring after upper respiratory tract infection, which may be either viral or bacterial. Vitamin D has an essential role in human immunity, including increasing mucociliary clearance, influencing the production of antimicrobial factors, modulating inflammatory pathways, and influencing the microbial communities. This study aimed to evaluate the effect of vitamin D supplementation on the recurrence rate of acute otitis media among preschool children. The result is Table 1 patient demographics among studied groups. The researcher divided them into two groups, the study group and the control group. The mean age in the study group was 4.3 plus minus 1.1 years compared to 4.4 plus minus 1.1 years in the control group, with no significant difference between both groups regarding age or sex. Table 2 was depicted clinical presentation among studied group. At the beginning of the study, a history of upper respiratory tract infection in the study group had been reported among 70% compared to 66.7% of the control group with no significant difference. After 6 months, the history had been reported among 23.3% of the study group and 56.7% of the control group, with a significant reduction in the study compared to the control group. Table 3. Number of AAOM episodes and vitamin D levels among studied groups. Finally, there was a significant increase in vitamin D levels among the study and control groups at the end of the study compared to the corresponding basal values, but the increase is marked in the study group but minimal in the control group. This is evident from the percentage of vitamin D increase at 6 months when divided by the basal values. Table 4. Categories of vitamin D levels among studied groups. The categorization of vitamin D levels is normal, insufficient, deficient, and severely deficient. The conclusion of this journal is vitamin D is a therapeutic agent that could be used as a prophylactic therapeutic option in reducing inflammation, working directly by itself or through a synergistic agent. Besides traditional therapeutic option, vitamin D supplementation to children with a history of RAOM plays a significant role in reducing attack frequency. I think that's all my presentation about vitamin D. Sorry if I had some mistake. Thank you for your attention, and Assalamualaikum warahmatullahi wabarakatuh.